Good morning, everyone, and welcome to 10 Healthy Built Environment Assessment Tools, a webinar hosted by PlanH and Vancouver Coastal Health. We are really excited to have so many people joining us from across North America, and we're looking forward to getting started and hosting some really great learning for you today. My name is Sandy Mackey. I'm a Healthy Community Planner with BC Healthy Communities, and I'm excited to be your host for today's webinar. I'll be introducing our speakers as we move along, and we'll be hosting and facilitating the question-answer period at the end of the session. I'd first like to start by acknowledging that the land on which BC Healthy Communities operates is the traditional territory of the Coast Salish peoples, specifically the Lekwungen and Wasanic, and is on the territory covered by the Douglas Treaties. We work as visitors on their traditional territories and are incredibly thankful for the opportunity to work and live in this beautiful place. Today's agenda is pretty quick. We've already done our technical orientation, and then we're going to have three speakers, Sami, Dr. Shah, Dr. Amstead-Meyer, and Colin Bailey. At the end, we'll have a brief summary of learnings and a question period. So we'd ask that you keep your questions until the end of the session. As we move forward, you can use your keyboard to type in comments or questions in the chat box, and we will circle back to those during the question period. And then once the question period starts, feel free to raise your hand using the technology, and we will call on you if you'd like to ask a question over the phone. BC Healthy Communities is a nonprofit society. We launched in 2005, and we serve the province of British Columbia, providing services, programs, and resources for creating healthy, thriving, and resilient communities. We've got a multidisciplinary team of public health professionals, planners, evaluation specialists, and communication specialists. We all work collaboratively across sectors to support communities across the province and health authorities across the province. We're really excited today to be facilitating this webinar through our PlanH program. PlanH supports local government engagement and partnerships across sectors for creating healthier communities. Community policies, plans, and decisions affect health and well-being, and PlanH provides learning opportunities, resources, and leading-edge practices for collaborative local action. We work with health authorities, the Union of BC Municipalities, the Ministry of Health, and the province's health promotion strategy. Our deliverables emphasize three key objectives. First, local government support, including grants and project expertise. Second, health authority support, including education, advice, and resource development. And finally, collaborative support, which emphasizes local government and health authority partnerships in all projects. Since 2012, we've been really lucky to support 195 communities across the province. As you can see on that map, it ranges from the far north of British Columbia to the southern tip of Vancouver Island. And we've got a new emphasis on rural and small community projects moving forward. So we're hoping to expand some of our work into those areas that we see not covered on the current map. So let's just pull up an affiliation poll. So before we get started, it would be great to see where everyone is coming from today, whether it's business or private sector, the provincial government, nonprofit, or even school districts. Just vote using the buttons on the side of the names of the affiliate. So it looks like health authority makes up most of the people we've got joining us today. And if you type in other, you can write in what your type is. So it looks like we've got a lot of people from health authorities, business and private sector, the federal government, that's exciting, nonprofits, and provincial government here today with us. Exciting to have such a diverse group of people on the same webinar. So today's learning objectives are relatively simple. Hopefully we can get to them in an hour and a half. We're hoping to help local governments identify useful tools that can be used to support their healthy built environment work. We're hoping to support understanding of how various domains of the built environment can impact health and inclusion of health in planning and decision-making processes. And we're finally going to showcase tools that can help facilitate partnerships between local government and health authorities. As a reminder, if you're accessing the webinar over the phone, please keep your phone muted unless you are presenting. You can mute your phone by pressing the mute button or *6. And with that, I think we will get started. I'm really excited to introduce Sami Hoang, who is an environmental health officer working in the Healthy Built Environment program and in health protection at Vancouver Coastal Health. The purpose of their program is to influence and support the creation and sustainability of healthy built environment healthy built environments to improve health outcomes through disease and injury prevention within Vancouver Coastal Health communities. To achieve this purpose, the HBE team collaborates with local governments and key partners in communities to encourage and facilitate the inclusion of health and well-being into planning policies, guidelines, processes, and decisions. Sami has a Bachelor of Science and a Bachelor of Technology in Environmental Health, and she has been a Certified Environmental Health Officer working with VCH since 2017. Sami, I'll pass it over to you.
Thank you, Sandy. Welcome, everyone. Thanks for joining us today. I'm really grateful to have this opportunity to talk to you today about the Healthy Built Environment, or the HB Assessment Tool Guide that PlanH developed in partnership with VCH. Before I start, I'd just like to acknowledge that the facilities and services of VCH are situated within the traditional homelands of the Musqueam, Squamish, and Tsleil-Waututh people. And for those who don't know, VCH serves urban and rural communities that include 12 municipalities, including Richmond, Vancouver, North Shore, up the Sunshine Coast, the Sakai Corridor, Powell River, and up all the way up to Bella Bella and Bella Coola. We also have 4 regional districts and 14 First Nations communities. I'd also like to take this opportunity to introduce our regional HBE team. Our team consists of 2 environmental health officers, or EHOs, including myself, working on regional HBE issues, as well as senior EHOs from each community of care, a manager for health protection, a medical health officer, and an environmental health scientist, who's quite unique to our team. Our HBE team works closely with the population health team and local district EHOs within our communities to provide the local context and perspective. Our main objective is to work with local governments and key partners in communities to encourage them to consider including health and well-being into planning policies, guidelines, processes, and decisions. And our activities can range from participating in high-level policy initiatives to reviewing specific planning proposals, taking part in impact assessments, to knowledge translation of health evidence. This is our vision, and it shows the simplicity of it and yet captures the significance of each of the different planning, designing, and engineering roles in ensuring that health is the focus. So the purpose of this guide, the guide was designed to support local governments to assess features of the built environments within communities. The 10 HB assessment tools are presented in this guide, and our hope is that these assessment tools, when they're paired with community engagement health data, will support local governments in identifying strengths and gaps within the built environment and help further understand how those gaps might negatively impact health. The local governments can then work with their regional health authority or First Nations health authority to prioritize actions and create healthier communities through building healthier built environments. So I'll quickly go over how these tools can actually help achieve these outcomes before we get to the actual introduction of tools. So we know that the built environment consists of the structures and human-made environments where we live, work, play, and socialize. We're familiar, or I think we're familiar with the 5 core features of the built environment based on the HB Linkages Toolkit, which are the neighborhood design, transportation networks, natural environments, food systems, and housing. The design of the built environment, as well as the relationship between the built environment and how people interact within these environments, plays a significant role in influencing human health and well-being. The way built environments are designed can impact a number of factors that influence health, like health behaviors such as physical activity, healthy diets, social connections, injury prevention and safety, which includes the perception of safety, environmental exposures such as noise, air quality, heat, other exposures resulting from climate change, as well as equitable access to services and spaces like natural environments, housing, and transportation. We have to understand that the way these services or features are provided affect the choices that individuals make, which affect their health, and therefore we need to consider health in the planning of each of these areas. It's also very important to consider equity when assessing built environments, because features of the built environment that negatively impact health and well-being are also known to disproportionately affect people in lower socioeconomic positions by the virtue of where they live. So why use HB assessment tools? Because of some of the reasons we just went over of how built environments have significant impacts on community health. To gauge how the built environment is impacting or will be impacting the community health, it's important for local governments, including Indigenous communities, to assess the existing and future planned features of the built environment. But it can be challenging to choose which features to look at for enhancements or for future developments. So a variety of HB assessment tools have been developed by many different organizations, and many of them are validated. There were a number of advantages we could think of using HB assessment tools, and it all goes back to the purpose of why we developed the guide. The tools can help communities identify the strengths and gaps of existing built environment features and see where they need to prioritize in terms of enhancement. We also think these would be really great tools to use for community engagement to get public input, especially during planning and decision-making processes. It can help local governments identify what barriers exist in the built environment, and it's important to create opportunities for all community members to participate and be fully engaged in the processes. So these tools can be a really good resource for this type of engagement. This guide and the tools also emphasize health throughout, so it's meant to encourage local governments to partner with health authorities by discussing priority actions and working in collaboration to achieve the mutual goal of creating healthier communities. And finally, some of these tools can be used to collect data on baseline conditions and also monitor progress in creating healthy communities. Like, are changes in the built environment being translated into desired health outcomes? That's a question you might ask. So continuous evaluation is needed, and it can lead to the review and revision of existing plans and policies to further promote healthy communities. And of course, there are some limitations. The tools don't represent all determinants of health, which impact overall population health. This also emphasizes the importance of local governments partnering with health authorities and health professionals in order to better identify the potential for existing health and equity gaps. Also, the tools vary in types of domains, indicators, and criteria that are used to assess the built environment. For example, like some tools are intended for assessing only existing built environments, but not for proposed built environments. And because of the range of tools available, local governments and communities should select more than one tool that includes indicators for built environment features that they want to focus on.
All guests have been muted. You can unmute your line by pressing *6.
Sami,
Yes,
because we had to mute all the lines, we need you to unmute yourself so that we can hear you again. And you can do this by pressing *6 or the mute button.
Can you hear me now?
I apologize. There was just some background noise that we needed to rid of.
Can you hear me?
Yes.
Hello?
Oh, yep, you're back on, Sami. Thank you. Sorry about that.
That's okay.
And if you can speak up as loud as you can as well.
Sure.
Thanks.
So I think I was saying, yeah, so two types of tools that are in this guide are systematic observation or audit tools and self-administered questionnaire type tools. Also, if you look inside our guide, we've identified whether each tool is suitable for rural or urban settings by using icons. They're also going to be showed on the slides as well. I'm not going to go through the specific details of this table, but it's an overview of showing the differences between the two types of tools, like what types of data are collected, when to use each one, some advantages and limitations of each, and which tools in the guide might fit into which type. One thing to note is that technically both types of collection tools are used to collect data that's somewhat subjective, whether it be collected by a professional like a planner or a community member. More specific details on the characteristics of each tool type can be found within the guide once it's released. And here we're going to pull up a poll question to ask if you have any experience using any of these 10 tools. So it's, while the poll's coming up, about 10 of them, yeah.
Yeah.
Just as a reminder, everyone, if you are not currently presenting, so if you're not Sami, please mute your phone using the mute button or *6.
Oh, wow. So a lot of people have encountered the Bikeability and Walkability Checklist, the Rural Active Living Assessment Tool. Somebody's used at least each and every one of them. That's great. Okay, so now I'm going to go quickly over each tool, just showcasing it for you all in terms of what types of features and domains the tool focuses on. Trying to also link it back to the HB linkages toolkit, so using some of the familiar domains and some advantages and limitations of each tool. I just want to say that we as a health authority have not used these tools, but we really think it's a good tool for municipalities and Indigenous communities to get talking about the built environment, especially with the public and community members, and talking about how it links to communities' health, and then maybe partner up with the health authority to talk about the results and address any gaps. So the Active Community Toolkit for reviewing development plans was developed by Middlesex London Health Unit, and its main purpose is to help public health professionals like regional health authorities, healthy community, and HB teams to provide standardized input regarding active community design when reviewing developments for the local government. But if you're a local government staff in departments like planning, design, transportation, if you're an engineer, Parks and Rec, you might be interested in using this toolkit to ensure that the elements of the built environment are encouraging active living and healthy lifestyles. This tool can be used to assess the active community design elements that are incorporated into development proposals using 4 key domains, which include mixed land use, mixed housing, complete streets, and public realms. And if you do look into the subdomains, which aren't listed here, in relation to the linkages toolkit, these domains mainly focus on neighborhood design and transportation networks and housing. But it does look at public realm as well to support public areas for placemaking, social connections, and also looks at perceptions of safety. So some advantages that we could think of for this tool is that it definitely supports and encourages public health and HBE professionals to work in partnership with local government. It supports active community design elements that can be integrated into development proposals, which is a great time for health to provide a health lens or municipalities to ask health to provide a health lens. It's very easy to use. It has questions that mostly start with, does the plan, and then the reviewer can either answer yes or no or not applicable. To make it really clear, the words are underlined to emphasize what aspect of the built environment is being evaluated. And for health professionals, it can be used to assess site plans, area plans, subdivision plans from the local government, and it encourages both local government and public health or HB specialists to integrate HB and active design principles into the proposal. One of the limitations is really that it assumes that each development application should strive to include active community features as a fundamental design principle, but realistically this won't be the case for every application or plan. So not all the criteria may be applicable to all types of plans. There's also a limited amount of information on the validity and reliability of the tool, and also another limitation is that it might not be applicable to rural or small communities. The next one is the Healthy Development Assessment Tool, which was developed by the region of Peel for those who play a role in planning, designing, and approving development. There's 2 versions of the HDA tool, one for large-scale projects and one for smaller-scale projects. Both tools assess and score development proposals across 6 domains of the built environment, which include density, service proximity, land use mix, street connectivity, streetscape characteristics, and efficient parking. So this tool is suitable for local governments, including planners and developers, in creating healthy, supportive environments and measuring the health-promoting potential of a planning or development proposal. These elements are generally around neighborhood design and transportation networks. Housing is part of the land use mix domain. And if you're wondering what they mean by efficient parking, the objective is to mainly discourage private automobile use and promote active transportation. So it's more towards reducing car parking while increasing other things like bike parking. One of the advantages is that it works within existing planning policies, regulations, and standards with which all developers should comply to. And you can also make tailored assessments depending on the size of the development, so large versus small for the version of the tool. And there's a user guide that comes with it, which also makes the tool really easy to understand and administer. The limitation of a tool is that it's not meant to be applied alone to approve or reject development proposals. Rather, it's an informative component of the application evaluation process. And this actually applies to all tools in this guide. Not one tool is meant to be used to decide anything. And another big limitation here is that equity considerations are not expressed within the tool, so it's important to include an equity lens when using this one. So the built environment and assessment tool and manual is the next one, and it's the systematic data collection tool developed by the CDC in the States for assessing some features of the built environment as they relate to health behaviors like walking, biking, and other types of physical activity. The BE tool wasn't designed to assess every aspect of the built environment, except the tool assesses a set of features that was agreed upon by a few experts that developed this. So they include the built environment infrastructure, walkability, bikeability, recreational sites and structures, and food environments. This one's interesting. It does look a bit about neighborhood design, but mostly the transportation networks and what the food environment is like around the assessment area. It allows you to assess the built environment per street segment, and some questions raise concerns about accessibility as well. It even asks you what temperature and weather conditions were like to see if the built environment could be assessed any differently based on other weather conditions. So an advantage is that additional questions can be added if more detail about an aspect of the built environment is needed, like the nutrition environment and pedestrian environment. There's also an accompanying user guide as well for this one that explains how to train the data collectors or raters. And one limitation is that it doesn't give you specific direction on what to do for policy changes if you do end up with poor ratings. This is where you can maybe consult with your health authority's built environment team and collaborate to figure things out. The next one is the Place Standard Assessment Tool. It's from the National Health Service Scotland, and it's a tool for assessing places, whether they're new, well-established, or still being planned, so it's unique in that sense. This tool can be used to assess quality of a place and help identify priorities for a place. The tool consists of 14 questions spanning the physical and social elements of a place, and you answer some questions regarding each element and give it a rating. Then it's plotted on a simple diagram which helps visualize the ratings, see which domains were rated well or not so well. The elements do cover both. Yes.
Just one quick sec. I'm just going to mute all participants again because there is some background noise. So you will need to unmute yourself in just one moment.
Sure.
All guests have been muted. You can unmute your line by pressing *6.
Are you back on, Sami?
Hello?
I can hear you.
Okay.
Perfect. Let's try this again.
So the elements in the Place Standard tool do cover most of the linkages toolkit features, maybe except food systems. However, through the tool, it does emphasize equity quite strongly as it prompts you to think about different groups of people and how they would perceive the built environment as well. The tool can be easily used by everybody, like local government planners, HB specialists, health authorities, and even community members. So this makes it really great for community engagement purposes. So that was one of the advantages, that it was that it makes it great for community engagement purposes. And to make that even stronger, there's a Play Standard app for Apple and Android phones that makes it really easy to access and utilize for everybody. And the visual diagram allows the user to instantly see the strengths and weaknesses of the place. A limitation is that we do think it's, if you're trying to aim for more policy actions, it's not for that. It's mainly to guide conversations. But if that's what you're using it for, to guide conversations and initiating them, then it's actually an advantage. So it seemed like this one was really popular in the poll that most people have encountered. The Bikeability Checklist and the Walkability Checklist was put together by the U.S. Department of Transportation, and it allows individual community members, active transportation advocates, and even local governments to assess how bikeable or walkable their neighborhoods are. It asks a series of questions that are easy to answer, like, do you have a place to bike safely? How were the intersections you rode through? Or did you have room to walk? And was it easy to cross streets? Individuals can go on their route to work, school, running errands, or wherever else they enjoy biking or walking to, and use the checklist to measure bikeability or walkability and then advocate for change based on the score. It's really easy to use. It gives some suggestions on what you can do on an individual level and also how to advocate for changes on a community level if you've identified some concerns. And it's also a great tool for getting community members involved in active transportation and built environment assessments and advocacy. It's limited in actually the likelihood of initiating policy change or built environment changes. It's definitely more of a conversation starter. And although it doesn't give you specific directions on how to actually implement changes to improve poor ratings, the suggestions that are included at the end of the checklist can fuel some conversation around how to influence the policy changes. The next one is the Community Health Quick Audit Tool. It was designed by the Eastern Highlands Health District in Connecticut in the States to provide communities with an easy tool to assess their community's health by assessing built environment features that encourage two main things: physical activity and access to healthy foods. So if you see here, local governments, planners, and even community members can use this tool to quickly assess these domains and support healthy eating and active living in communities, even in smaller areas. So as I mentioned, these specifically look at features that promote physical activity and access to healthy foods. But this promotes also local food systems, if you see, like they incentivize farming and small growing spaces. And another domain that's asked here is rural transportation, which is actually in regards to specifically food systems, to see if residents have physical access to healthy foods, regardless of access to a personal vehicle. So it's appropriate for use in small and rural communities, which is great, and it's really quick and easy to use. Another repeating limitation is that it doesn't give specific direction on how to make any policy changes or built environment changes, and it doesn't specifically mention equity, although it is for smaller and rural areas. So it's important to keep the healthy equity lens in mind when using this tool. The Healthy Active by Design was developed by the Heart Foundation, and it's a master checklist that aims to create developments that encourage physical activity and support positive health outcomes. The tool promotes collaboration between government agencies, land developers, and the community, because everybody has an important role to play in healthy community development. For each domain, there is various principles and considerations to look at, which include destinations, housing diversity, movement networks, public open space, sense of place, community facilities, buildings, and healthy food. The design strategies are rated according to how strong the supporting research evidence is. And so if you're familiar with the linkages toolkit, it's kind of similar to that, where the evidence diagrams show the strength of evidence in relation to the impacts and the health-related outcomes. And it does go over all the HB linkages features, except maybe the natural environment. The advantage of this one is that it's evidence-based, and it shows the connection of indicators to the strength of supporting research evidence. But again, it doesn't give you specific direction or suggestions on how to implement any changes to improve the poor ratings. The last one you're going to hear from my end is the guide to the Healthy Streets Indicators tool. It's developed by the Transport Authority in London, and it's based on the Healthy Streets approach that uses 10 indicators of healthy streets to assess and inform decisions about how we design, manage, and use public spaces. The main indicators are pedestrians from all walks of life, and people choose to walk, cycle, and use public transport. The other indicators point to elements that are essential in supporting these main indicators. And these mainly focus on active transportation, but incorporate perceptions of safety and other factors that would affect people's behaviors and transportation choices. It's also interesting to note that it considers environmental exposures as factors like air quality and noise. An advantage is that it's, again, easy to use and implement. It asks a series of questions that relate to each element. Anyone can answer them based on their personal experiences. So it's another great tool for public engagement purposes. Another advantage that I don't list here but I do see is that it has pictures to go along with the suggestions of how to improve the built environment to support the indicator. And because I've received feedback from planners before that the linkages toolkit don't have pictures to show what a good example of a built environment would look like. The limitation here is that there are open-ended questions. There's no systematic rating system. And again, it doesn't give you any specific direction on how to implement any policy changes. And it is quite urban focused, so it wouldn't be suitable for a smaller rural community. So the two tools that I didn't mention were the metrics for planning healthy communities and the rural active living assessment tool, which I think from the poll some people have accessed before. The metrics for planning healthy communities will be presented next by Dr. Sagar Shah, and the rural active living assessment tool will be presented by Dr. Renee Amstedmeyer and PhD candidate Colin Bailey. Just to finish up, here are also some resources that we found would be very useful for similar purposes, but we didn't include it in the guide based on the types of tools we're introducing. But I highly recommend you to refer to them if you're from the municipality or a community member advocating for healthier communities, or even interested in expanding your scope of healthy communities and HBE. The last one listed here is the My Health, My Community data, which is more of a survey that was used in the Vancouver Coastal Health and Fraser Health regions to collect health data. And the survey has helped us immensely to identify specific vulnerabilities within a community, and the results have been brought down to the neighborhood level, which can really help illustrate discrepancies or inequities that might exist within the city. So if you're part of these regions and you're listening, feel free to look up your neighborhood profile for the health data. We're also working on putting out a round 2 of the survey this spring, so please stay tuned for that and help spread the word to get it filled out. It's really been a great tool, and we've been told several times that it's really helped local governments reference their priorities. Thank you.
Perfect. Thank you very much, Sami. It's some great information that I think will be really useful to everyone on the line. Up next is Dr. Sagar Shah. He's a manager of planning and community health at the American Planning Association. In this role, he currently leads applied research projects connecting urban planning and public health at the APA. Dr. Sagar's research includes investigating the role planners can play in creating healthy communities with an emphasis on health equity. In his academic and professional career, he has worked on multiple applied research, community-based research, and basic research projects. In addition to research, he has a passion for data analysis and teaching. Dr. Sagar holds a PhD in regional development planning from the, Dr. Shah holds a PhD in regional Development Planning from the University of Cincinnati, and a master's degree in planning from the University of Southern California. And just as a reminder, if you'd like to ask some questions, feel free to leave them in the chat box, and we'll get to them later. All right, Dr. Shah, off to you.
Thank you, Sandy. Can you hear me okay? Hello?
Yes, we can hear you fine.
Okay, awesome. Hello, everyone. Thank you, Salah, Sandy, and BC Community Health for asking me to present in this webinar. It seems to be amazing information that they would like to share, and I'm happy to be part of it. As Sandy told, my name is Sagar Shah, and I manage the Planning and Community Health Center at American Planning Association. So our audience are practicing planners in the United States. What I'll do is basically talk a little bit about our work and then talk about metrics for planning healthy communities toolkit or project that we worked on. Planning and community health, we provide tools and technical support to members to integrate health into their planning practice. Here are some of the examples of the projects that we have worked on. And as you can see, there are a range of projects. We work on food access, we have worked on health in comprehensive plans, we have worked on health impact assessment toolkits, planning and zoning, etc. Traditionally, we have focused on 3 areas, I would say: access to healthy and nutritious food, healthy active living, and health in all policies approach. Recently, however, since last couple of years, we have been trying to diversify and work more sort of on like emerging issues. So we are in the process of working on the effect of disaster affected areas and the effect of disasters and climate change on health. We also want to work on something on gentrification and the effect of gentrification on mental health, etc. So in coming years, you will see more diverse type of reports, projects, toolkits coming out from the center. So what we work on, we typically use 3 types of mechanisms to work on projects. The first one is applied research, and I won't talk a lot about that because the project that I am going to present next falls into this category of applied research. The second type of mechanism we use is place-based work, which is we work with communities on the ground. A flagship program in this particular mechanism is Plan for Health project that we worked. It was a 3-year project in which we funded 35 coalitions across the United States. And interesting part of the coalition was the coalition was supposed to have a representative from a planning profession, from a public health profession, and a community-based local organization. So it was like coalitions formed of at least this 3 groups, and in most of the cases more than this, to work on access to healthy food, access to physical activity locations such as parks. So that's an example of how we work with communities. Right now, we are working with 3 communities in Colorado, California, and Florida to help them integrate health and equity into their comprehensive plans. And the third type of mechanism is training and education. So, for example, at the beginning of last year, we heard from our members about how they didn't have enough tools, training, education, information about how can planning influence opioid epidemic? Like what is the role of planners? So we had like a 3-part webinar series on the connection between planning and opioid epidemic. So we invited public health schools and professors working in those schools to talk about basics of opioid epidemic, what it is, etc. And then we invited planners on the same panel to talk about NIMBYism that is going on around all over the country, also talking about the land use and the zoning and the housing policies related to group homes and methadone clinics. So we work on various, and as I said, we are trying to diversify and work more sort of this type of topics now. I'm not able to. I'm not able to forward the slide, Sandy. Can you do that? Yeah, perfect. Thank you. So my focus of this presentation will be focusing on the methods for planning healthy communities, toolkit, or the report that we created. There is a lot to talk about, obviously, but I won't go into details, but provide an overall perspective of this toolkit and the report. The work was funded by CDC, and it grew out of our previous work with CDC on comprehensive planning and implementation. In that work, it was highlighted, the role of health matrices and indicators was highlighted. And we decided, okay, let's take the work further and work on this project where we talk about matrices, policies, indicators related to planning healthy communities. This project report and the matrix is available for free to all the members and non-members, actually, because it is a federally funded project. We have everything for free, so it's not like a member benefit if you join APA. It's available to everybody. So please go and look at the report. I think in this presentation, at the end, I provide a link to the report. So in order to get like feedback from people who actually work on ground, we had advisory committee experts in the field of public health and planning. We invited these people to guide us through the whole process. They were people from, as I said, background in public health and planning, working at that intersection. We had people from private sector, from public sector, working at city level, county level, etc. So we tried our best to get a group of people that are diverse and can guide us into this process very well. In terms of metric selection criteria, and soon in like next 2 or 3 slides, I will show you what do I mean by metric. So in terms of the selection criteria, so what metric can be included in this particular report? We had this criteria that you see on the screen. The first one was relevance, like how does the measure, how does a metric measure something that planners work on? So that's very important. Relevance to planning and planners. Magnitude, how much impact that particular metric would have on the built environment related to health. Feasibility, is the data available or could it be easily available? Equity is a lens that we apply on all our work. So can the metric identify and be used to address disparities in exposure and outcomes for underserved populations? And the last one was utility. Is it useful to planning practice? Is it even necessary for planning practice? So those were the criteria that went into deciding what goes as a metric in this report. So the first step was, before we work on policies, indicators, matrices, the first step was identifying the domains where planners could intervene to improve health, right? So we looked at the gray literature, academic literature, and then got the feedback from the advisory committee to identify those domains. And we identified 5 overarching domains through which planners can influence health. And most of us, I think all of us know most of this. First one was active living. The second one was healthy food systems. Third one was environmental exposure. Fourth one was emergency preparedness. And the fifth one was social cohesion. And I think Sami touched all these components or domains in her presentation in one report or one toolkit or another. Our attempt was to bring everything together. If a planner can get this report, that particular planner would get an overall perspective of how planners can influence health. So I would like to say a disclaimer that we don't go into really minute details of each of these domains, because the purpose was to give this overall perspective of the intersection of planning and health. Each of these 5 domains were further divided into 14 subdomains. So for example, active living was divided into active transportation, which is going from origin to a destination A to B with a purpose. Also included active recreation, which is walking, jogging, biking, etc. And then traffic safety, which is mainly focusing on safety of pedestrians and people who bike. And I'm not going to go into all the subdomains, but you can see on the screen that we think when we hope that we covered all the domains and subdomains that planners can influence health. We provided, this is the metrics I'm talking about basically. So we provided a table which was divided into 4 columns. And the image that you see on the slide is just an example of one domain, active living, right? So in terms of this particular table, the first 2 columns, as you can see, are the domain and the subdomains. The next 2 columns are important to planners, right? The first one is built environment assessment indicators, what we would traditionally think of as matrices and indicators. And the second one are planning policies. So considering these indicators, once you assess your existing situation, what policies can you use to improve health outcome? One disclaimer again, another disclaimer here is basically the indicators and policies are not parallel because of those other criteria that I talked about. We tried to make them parallel, like commute more share, then what are the policies related to commute more share, right? We were not able to do that considering the feasibility of the study or the relevancy of the data, etc. So they are not parallel, but if you are looking into a particular subdomain or a domain, then this is where you start. A unique part, I would say, of this particular toolkit or the work we did was talk about equity. And I will spend a little bit of time on this slide and then go fast through the other slides I have because I think most of you know this as well as the other thing. So for each report, for each domain in this report, we define what the domain means. We also define what each subdomain means. So we define active living, we define climate change, etc. And then discuss why it is important for population health. And then the role of planners in particular in that particular domain in improving health. So we talk about those things. Then we provide the metrics table, and then we talk about interwoven equity as a separate section. And here are some examples. So each domain has an interwoven equity section that discusses how low-income population and communities of color have been affected negatively by the built environment, right? So the connection between them. So for example, in active living, it has been shown that low-income and minority population have been shown to have low access to recreational facilities and parks. And therefore, it is important to provide safe and active modes of transport to address this inequality. So we talk about this type of examples and theory in this particular domain. In terms of food, healthy food system, research shows that major disparities exist in access to healthy and unhealthy food by income level, race, and population density. And those disparities are influenced, as we know, by various social determinants of health, but specifically by geography, economic status, and social factors. So it's important, the effort was to highlight these disparities and get planners to think about these aspects when they are working on policymaking. In terms of environment, environment justice means having equal degree of protection from harmful environmental exposure for all people, but we know that not all communities are exposed to the same consequences from negative environment. Many places in the United States and in Northern America, low-income people and communities of color have long history of disproportionate exposure to environmental hazards. And it's important that we took those things into consideration. In terms of emergency preparedness, it's a poor, underserved, and again, minority population have been often disproportionately affected by polluting land uses and natural hazards, right? And with recent climate events, especially in Puerto Rico, Virgin Islands, is an example of how low-income populations and communities of color are many times ignored. We are right now working on a project in Puerto Rico, and it seems like it's so difficult to, in terms of the bureaucracy and in terms of the system there, the system is so tough to work, even if they have dollar amount, because many times one of the arguments that we often mention is that we don't have resources. I mean, the problem there is they have some resources, not as much as they would like, but it's not even getting channeled to the right people. So those issues are very important that planners think about when we work on improving health. Social cohesion. I mean, I talked about how we are trying to work on gentrification and its effect on mental health and stress. And we know gentrification is affecting, especially in the United States, in all larger cities, and people, low-income people as well as minority population are adversely affected by this process. So it has positives, it has negatives, right? So gentrification without displacement would be good. A good built environment, if it doesn't pushes people away, is good. So we are trying to work on how that impacts mental health, and as well as like maybe it leads to connects with other negative effects such as opioid use, etc. I just wanted to highlight through this slide the importance of focusing on equity in all work that we do, including the indicators we calculate, the matrices we create, and the policies we make. Next 3 or 4 slides, I won't go into detail. I'll be fast. What I do is in next 3 or 4 slides, I just give one example of a metric from a domain and then the policy. So for example, in active living, the metric is annual rates of fatal and serious pedestrian and cyclist injuries. And the policy is traffic calming policies and related design guidelines, like very broad level policy. It doesn't go into like minutiae because we are a national association and we want planners to everywhere, small communities, rural communities, urban communities, county level, regional level, to work with these indicators and policies. So it was intentionally kept a little bit broader, and we talk about that in the report as well. And many of our policy metrics, as in this example, were identified as key instruments to address issues that come to light when planners use built environment methods to evaluate existing conditions. And in this way, planners and their partners can advance systems change. And that's what we are looking for, right? Systems change. Going to another example, the second domain is healthy food system. One of the example of metric is percentage of low-income population living in urban areas that are not within walkable distance of a full-service grocery store. And we focus specifically on low-income population because research suggests, I mean, yeah, if you have a car and if you're living in a rural community, if you're rich, you can drive to the grocery store even if it's 5 miles away. So we are more interested in looking at people who don't have enough resources to access healthy food, right? And one of the policies is basically financial incentives to corner stores for carrying healthy food choices. So this is sort of policy which is directly not within the wheelhouse of planners. Planners may not have a lot of influence on it, but it's an effective policy that I have seen and we have seen work in different communities in the country. And maybe planners need to know about it and promote and try to get such type of policies into their work. Environmental exposure. One of the metric is acres of brownfields that are not remediated. And the policy is policies prioritizing brownfield remediation and urban infill. Emergency preparedness is huge. We did a recent survey of members in terms of what their top priority is in terms of research, and climate change was number 1. We have a hazards planning center. Like I work in planning and community health center, but we also have like hazards planning center, and we are trying to do cross-center work to connect the effect of climate change on health. So one of the metrics is total housing units contained within sea level rise projections, and the policy is climate change data or a projection integrated into all future planning efforts. We don't think about this many times, especially inland communities. Yeah, Florida's, California's, New York's, and New Jersey's are thinking about it. Hawaii's, but not the rest of us. And flooding is only one disaster, right? There are so many other disasters that often get neglected. And it's important that we consider all communities consider this aspect when they talk about the plan making process. Social cohesion, I mean, this is, we all have been working on this aspect since ever. One of the metrics is percentage of households paying greater than 30% of monthly household income towards housing, and the policy is basically land use and zoning policies to promote affordable and fair housing. No need to mention anything here because we all know the importance of housing and the role planners play in housing policy. So the question is, why should planners use this, right? First thing is to assess existing conditions. And I think a lot of the tools that Sami are being part of this project can be used to assess existing conditions. So this is another tool that you can use. It can also be used to organize information. So we have had examples where we got reached out by communities who wanted to integrate health and equity into their XYZ work they were doing. Some were working on comprehensive plans, some were working on strategic plans, etc. And they were like, this is a good framework to organize the information in their report and their work. So it was a good sort of, because we divide everything into domains and subdomains and indicators and policies. So it was really helpful to them. To guide policy and plan making, yes, that's an advantage. We don't talk about everything, but we try to highlight on key aspects. Facilitate project evaluation and tracking. We understand that, especially in United States, we make plans, but we don't evaluate plans. Unlike public health professions, where everything is measured, everything is measured and evaluated. So this is a sort of a tool that people can use to evaluate and track the progress. So person can evaluate or assess the existing condition. A planner can assess the existing condition. Form a policy to address that particular condition if it's negatively impacting the health, and then 5 year or 10 year down the line can use the same tool to evaluate it, right, to see the effect of policy making. There are some considerations for this project. I would say some limitations, but these are intentional limitations, I would say. So one is, what about other matrices, right? The included indicators and policies do not represent, as I mentioned before, an exhaustive list of features that determine healthy built environment. Rather, it just focuses on a set of matrices proposed to start discussion and to start people thinking about it. And we talk about some critical areas. The second question is, what about the qualitative data? Because all the proposed built environment indicators in this toolkit are quantitative in nature. And that was intentional because quantitative data are often more readily available to planners in terms of GIS data, census data, ACS data, and are usually simpler to measure rather than going out and doing survey, which many times we hear that is not, we again come to the same point of they don't have enough resources or time to do that. So we focus on quantitative data. However, we do mention that qualitative data is important, and in many instances, as seen in other toolkits in this report, may be more useful than quantitative data. So we understand that. Geographic scale. So I mentioned this point as well. The geographic scale at which the indicators are calculated or could be calculated is not specified. So we don't say that this is for urban, rural, mixed type of neighborhood. Such calculations would depend on many local factors, and we understand that. It also depends on other factors such as data availability, technical expertise, and resource availability. So we have kept it a little bit general, tried to provide overall perspective, not looked into geographic scale. And the last one is, what are the right benchmarks? And we got this question a lot, actually, when we were actually working on the project and after the project. And we debated a lot with the advisory committee in terms of providing specific benchmarks for each indicator. So access to healthy food. What is a good access to healthy food? We don't know. There are 10 different definitions in academic literature. And that's why we thought, I don't know if a rural community is using it, using a 0.25 or a quarter-mile distance doesn't work with them. They may be looking at a different type of measurement or benchmark than a urban community, which we may think that, yeah, if it's not in a quarter mile, then it's not good. So we intentionally didn't talk about this benchmark because of two reasons. One, we want everybody to use it, and the second is many of these benchmarks are community specific, right? And there is no consensus in terms of what the correct measure is. In terms of applications, I have next two slides in terms of applications. So how do these metrics advance planning for healthy communities, right? As I mentioned, we hope and we think that this provides a more comprehensive framework of planning for health and provides actionable guidance in terms of you do this, yeah, you do measure this, you use this indicator, but then we'll also push the planners to talk about policies. even though we don't talk about each and every policy related to healthy built environment, we talk about at least make them think about those policies. And I'll give you examples where communities have used and gone beyond this particular report to integrate health into their work. And obviously, as I mentioned, we focus a lot on equity and equity components, and one of the criteria for selecting these indicators was that they can be used to do sort of health disparities analysis with these indicators. Other applications obviously can be used for plans, regulations, policies, community outreach, advocacy, mapping, scenario analysis, and outcome-based budgeting. So various ways this can be used. I'll give you a couple of examples. The town of Ossining in New York updated their comprehensive plan and one of their first priority as per their public participation process was health. And they used this report, like metrics, to guide policy development and outreach. Another example, Charlotte, North Carolina, the MPO there, was using metrics in active living domain. So their one domain that they wanted to look into was active living, right? So they started with this. They started with this metrics and then deep dived into active living, and then used with the other toolkits that have been identified in this report. And yeah, this is a link to how you can download the report. So I just wanted to keep this so that if people get this presentation, they'll be able to get the link. Last couple of slides, not related with this project, but regarding our work, we really believe that we can achieve we can design or plan true healthy communities when we work cross-sectorally, right? So we at APA and Planning and Community Health, we have been focusing on working with other sectors. We are part of, giving one example, we are part of a joint call to action for promote healthy communities where we are working with other professions such as architects, planners are there, APA is there, APHA, which is Public Health Association in US, ASC, civil engineers. We have NRPA, Park and Rec people. We have ULI, which is real estate people. And we have landscape architects, and we have Green Building Council. So we are working with these national organizations to help our local chapters and local planners, local professions to integrate health into their work. So they come together, talk about this thing, and talk about their role in creating healthy communities. And we as a national organizations come together to provide a guidance type of thing to them. So I think I'll end with that. And again, thank you to BC Healthy Communities for giving me an opportunity to talk about this project.
Thank you very much, Dr. Shah. It's really exciting to see so many new tools for advancing healthy communities work and new metrics for measuring our progress and showing our progress to our partners. I'm going to introduce our last two speakers together as their presentations will sort of bookend one another. Dr. Renee Umstead-Meyer is an associate professor and graduate program director in the Department of Public Health at Baylor University. The aim of her research is to advance health equity and active living through creative solutions to increase active play and physical activity opportunities for all, in which she prioritizes diverse, underserved, and rural communities. She and her husband spend time walking, cycling, and spending time outdoors, playing with their two energetic children, or in the living room for family dance parties or sing-alongs to Baby Shark. And Colin Bailey is a PhD candidate in the School of Kinesiology and Health Studies at Queen's University, which sits on the territories of the Anishinaabe and Haudenosaunee nations. A community-engaged researcher, Colin's work focuses on facilitating the use of indigenous methodologies and methods, as well as working with First Nations youth to explore their environment using indigenous ways of knowing. As part of his ongoing research, Colin is working with community partners and youth co-researchers to validate a physical activity environmental assessment tool that supports wellness by exploring the relationship between physical activity and First Nations peoples. Dr. Umstead-Meyer, I'll leave it with you.
Perfect. Thank y'all so much. Can y'all hear me?
Yes, you sound great.
Perfect. Thank you so much for confirming that. And I want to thank Celeste and Sandy and Sami for the invitation to join y'all today. I'm very excited to have the opportunity to talk about a tool that I spent a lot of time helping develop. And again, as was just mentioned, Colin and I are bridging our our presentations together. And so I feel like I'm setting the stage, hopefully with some background information around the RALA tools, the Rural Active Living Assessment tools, to where he can then talk about how he's been using them with the First Nations communities he's been partnering with. So just a little bit of background, I'm hopeful that many of you don't need some of this, but just since this is a variety of different health assessments, physical activity is very important. Globally, we have fewer children engaging in physical activity than any of our guidelines, either from the World Health Organization, Canada, the U.S., or other countries are stating. And that's really a problem. And really what we see in that is that fewer females and youth from communities of colors are meeting these guidelines. And so in thinking about that and in thinking about some of the specific nuances to some of our populations and communities that have larger health disparities, thinking about rural communities. And so just looking at basically 19% of Canada and America residents live in the rural community. And just to throw up a quick poll, just to get a sense of us thinking, just checking off which one of these or multiples of these kind of describe you in terms of a rural community. And I just realized that I didn't give you an option if you have no connection to rural communities. So I apologize for that. But the just thinking about, when we think about rural communities, and as I'll respond to that, most of us have some experience, some exposure to rural communities, whether we grew up in a rural community, which a number of us have, whether we currently work with rural communities and we've visited them, whether we've driven through rural communities taking a road trip. And so there's just a vast array of our experiences. And even though we have about 19% of our residents in the U.S. and Canada living in rural communities, many of us have experiences with rural communities. So thank y'all for filling that out, just getting a sense of who's working with who right now at the moment. And really thinking about why rural communities. And rural communities, for those of you, when you think about the image in your head, here are some pictures from some of the rural communities I visited. But there are really unique obstacles to incorporating physical activity into daily routines. Some of those are dispersed land use, fewer walkable destinations, fewer resources, whether that's preventive health resources or physical activity resources. And the infrastructure is just different, and oftentimes there are pulled needs within a rural community for where finances are going. And really, rural as a priority population is when you look at the literature and when you talk to people from rural communities, is rural communities are really, they're different from urban communities. There are some similarities, and depending on which specific rural town or small area you're talking about, they might be more similar. And rural communities really just, they aren't just a small city. And so taking a one-size-fits-all approach to physical activity promotion doesn't necessarily meet the needs of rural children and their families in these communities. And so really thinking about how can we work to be more specific and tailor to working with our communities that are located in rural areas. And so this work that I'm going to talk about is the development of the RALA tools. And it really began in two different phases. It started with a research project that was, I'm going to call our formative phase, where our goal was to say, hey, what in the world does active, friendly, rural communities even look like? What does that look like? And so a group of us are funded by the Robert Wood Johnson Foundation, Active Living Research, a little over 10 years ago, some time in a variety of states in the U.S. With decent diversity across those states, geographically, the people that were living there, and some other various characteristics. And we used a variety of different methods, many qualitative methods, really trying to understand what in the world does activity-friendly spaces look like in rural communities. And when we came out of that, we developed a conceptual model element that had the following elements that are listed here. And these aren't necessarily so different than an urban or suburban setting, but really getting into some of the specific nuances that we saw within the communities that we were working with. And really many of us spent time talking to children, adolescents, and then definitely some of the adults within the community. And it was from that work that we moved to develop a rural-specific measure, because what we found is that what we were using and what existed wasn't really capturing what we were hearing and what we were seeing. And so we did an evidence-based search to follow up with that formative work, and really at that time looked at the tools that were available at the time. There has been an explosion of additional tools since then, but starting with environmental assessments from a physical activity lens and saying, okay, what works in these, what doesn't make sense to put in here, and what are some of the things that we learned from our formative work that we need to incorporate if we're going to develop a rural-specific tool. And you'll see some of those things here. And what we decided was that there really was a need for 3 separate parts of an instrument, or 3 separate instruments. For those of you who said that you have used the RALA tools before, you'll be familiar with these 3, and if you haven't, when you get to see them in the report, you'll recognize this. I'll spend some time talking about them for a second. So there's a town-wide assessment, there's a program and policy assessment, and then we retained a street segment assessment that was modified from what many together that already existed. And they were designed to be used together, but they can also be used individually if a community has a specific objective that they're working on, or they can be completed at different times to complement one another. At the same time, just as a side note, our team also across the sites developed a perception tool that was published about 2 years after the RALA tools were, and it was, I'm not going to talk about it today, but it was a perceived environmental support scale to kind of couple with this in terms of a relatively short way of getting perceptions from residents. And the other thing I want to mention is that the street segment assessment really might only be relevant for rural towns with walk town centers or highly resourced areas, or areas within a rural community where you have more than one street running through the middle of town. And so that's something that there might be many rural towns or small areas that don't even think that a street segment assessment would be useful, and we recognize that. Implementing the tools, we developed a code book, and it's an item-by-item description. An example of kind of what it walks through is we talk about how do you define what types of street segments you would even assess if you were doing the street segment assessment. And so looking at these zones within the community. So it's a kind of walk-by-walk at a table of contents of that code book is what I put up right here, just saying, you know, we start with some background. We start talking about how do you even think about a town center point within your rural community. And then when we're talking about the town-wide assessment, going through question by question, the program policy assessment, as well as the street segment assessment, and then some scoring information at the end. And so an example of one of the pages saying, okay, what exactly is a town center for you? And if you're not part of the community, figuring out, okay, can I talk to somebody in the community to figure out where do people think of as their center point to think through a town center concept. The street segment assessment has detailed information about the different zones to think about within a rural community. That usually looked at the town center, whatever that might look like for a community, looking at where the schools are located, looking at one major thoroughfare, looking at one of the residential areas. And so here's an image of the front page of the RALA segment assessment. And you can see that some of these are similar to urban-suburban assessments, but one thing I want to note is we made certain that sidewalks, for those of you who've been through rural communities, sometimes they're there and sometimes they aren't. And the research says sometimes they matter and sometimes they don't. That what happens in rural communities is often there are footpaths or other types of walking areas that you are more aware of or that are being used more. And so some of that was able to be captured. That's different than what some of the urban-suburban tools look like. Look at this is the front page of the program policy assessment tool, and it starts out with some of these questions and moves into programs that are being offered from a school perspective, a recreational perspective, and just kind of trying to understand what's being offered within your community. And then the town-wide assessment, the page that I have up is the front page, and it's an overview and a description of the town demographics and characteristics. The next part of this tool goes into town recreational amenities and basically has a documentation of what all exists and a very simple dichotomous or fair, poor, or good or excellent type of condition rating to where there's some sort of documentation to get conversation started. And so about hiking or walking, about biking paths, some of the things that might be there or might not, about some other things dealing with natural resources, like is there a river there, are there trails or mountains from that standpoint. And so walking through some of the things that might not be relevant for all communities but might be relevant for others. And so really our hope in developing this, which I'm much more excited about passing this torch in a second, is we really want to help communities document what their infrastructure is in terms of support for physical activity opportunities and helping communities have access to this tool and the information to help identify and prioritize, one, their capacity and strengths within the community, but also the gaps that might exist where advocacy can take place or where we can figure out how to pool resources around something, and to provide a forum for community engagement and communities. And really this last point of disseminating the RALA tools to allow for future use by communities and researchers interested in promotion of physical activity in rural areas is where I'm going to, I have 3 slides that are kind of thank you slides. I'm going to move through really quickly. But I want to focus on this because that's where Colin's going to pick up. And I'm so thankful that he was willing to join me today. So just some acknowledgments around funding and around my colleagues that were all integrally involved in the creation of the RALA tools.
Okay, so thank you, Renee, for sharing that introduction to the RALA tool. And I'm going to be talking today about how that tool had been adapted for a First Nations community project that I was working in Ontario and Manitoba in Canada. And just before we get started with my presentation, I know that no one indicated that they were a representative of a First Nations government, but I want to find out if anyone was working with any First Nations communities as part of your work. So I'm wondering if we can put up the poll. So I'm seeing already that there are a number of people on the phone call who do work directly or indirectly with Indigenous communities, and so that's great to see. Even if you don't work with Indigenous communities or particularly First Nations communities, though, one thing that I'm hoping to show through my presentation is how the Rural Active Living Assessment tool that Renee just discussed with everyone is a flexible tool, and it can be adapted to different types of environments if it doesn't fit exactly the type of community that you're going to be working with. And so before I began talking about the First Nations Active Community Assessment, I just wanted to talk a little bit about what makes First Nations community environments unique. And one thing that we've seen across the board, and something that was mentioned by Sami, is that there has been a shift away from a deficits-based approach and thinking about communities as places where they don't necessarily have the resources to fix the problems that exist in their community and that they need to rely on external experts. And so as part of that shift, we've seen a movement towards strengths-based approaches, and that's when there's been a lot more funding available to help Indigenous communities, and in particular First Nations communities up in Canada, to support knowledge sharing as a priority for research. And one of the reasons for that is because there has been a recognition that Indigenous knowledge is connected to the lands because knowledge is based on people's relationships to those lands. And so if people's knowledge is based on that relationship, we can look at, in turn, how health and well-being is tied to the particular land that people live on. And so with that being said, some of the things that we've seen come up in previous tools, things like walkability, traffic speed, land use mix, residential density may not provide us with a full picture in terms of how Indigenous peoples have a relationship to their land and to their territories. And the other thing that's important to recognize, and it's also something in terms of adapting a tool, is that because there are over 600 recognized First Nations in almost 1,000 communities in Canada and 60 different language groups, and they also have a variety of governance structures, so some people follow a traditional governance structure, some people use the Indian Act and have a chief and council, that those kinds of things are considered in terms of how a tool is developed and how it may be different from another rural environment. And so moving forward with that, and in recognition that a lot of the communities that we were working with in Ontario and Manitoba would be considered residential and rural communities, that there wasn't a particular physical activity environment assessment tool that fit the community needs in terms of those building on those strengths and sharing those strengths with other communities. And so this project really was developed based on a community-engaged research project with Seine River First Nation, Chippewas and Maywash First Nation, and Cross Lake First Nation. And those communities are located in central and northwestern Ontario, as well as northern Manitoba, to really develop a tool that would fit with those particular communities. And so as part of that process, the first thing that we did was we met with communities, we built a relationship with those communities, and we hired community researchers in the community to actually guide the research process that you're about to see as I progress through my slides here. And so the methods that we used to develop the tool are twofold. And one is that we had a photo voice project. And so in that photo voice project, people take photos to share their personal experiences that they have in their community. And oftentimes it acts as a catalyst for discussing community needs and community strengths. And so after we did some initial camera training, we had a number of youth who were aged between 13 and 18 years old. And they were asked the question, what are the spaces, places, and resources in your community that impact your physical activity? And so with that guiding question, youth went out and they took photos in their community, and you'll see a couple of photos that youth took on the left-hand side of the slide, representing different aspects of their community that they felt influenced their physical activity and their well-being more broadly. After those photos were taken, we came back and we used the socio-ecological model, which recognizes that behavioral influences exist at different levels, right from the individual all the way up to policy. And those were used as a sorting tool to kind of see where people felt that those influences were coming from. And so along with that, youth also completed the Rural Active Living Assessment tool. And so this activity was actually completed as a group. And so we walked around the community and everyone had an opportunity to complete the RALA assessment and to think about what elements in the RALA tool were consistent with what they were seeing in their own environment and what kinds of things they felt needed to be added or things that may exist in the tool that needed to be adapted to First Nations community context. And so this is the different themes that came out of the Photo Voice project and was really the guidance for helping us adapt the RALA tool for First Nations community environment. And so at the top, you'll see the Chief and Council policy and policies also at the school and organization level, which is in a gray color, influence physical activity. We also see community and cultural events. And those were social gatherings that the community did as a group, and that's in brown at the community level at the far left. The red and the yellow represent both infrastructure and the natural environment as influencing physical activity. And then other influences included transportation, which you'll see at the top in the pink. And then relations were also really important. And one thing that was interesting in the relations is that we know from research that role models such as coaches and parents and siblings have influence over physical activity, especially for youth. But other things that youth noted in the community was that their connections to the ancestors as well as to animals, especially for programming that involved animals, also had an influence over their physical activity. And so going back to the RALA tool, we got together in a focus group after people had an opportunity to do a walkabout and discuss what was consistent. And we found that a lot of the things in the RALA tool were consistent with what we saw in a First Nations community environment. And a lot of that might be due to the fact that most of the First Nations communities in Canada would be considered rural communities by population density, and over 70% of the communities in Canada have a population of under 500 people. And so we see that policies, infrastructure, the natural features in the environment, transportation, and physical activity programs were consistent. And one thing that was of note was that you'll see in the RALA tool that people are asked to comment on the presence of signage, parking, and sidewalks as potentially influencing physical activity. But one thing that we saw across the communities and was mentioned by a number of the youth that were involved was that the things that influenced their accessibility the most were things like hazards, cleanliness, and lighting. And so what you're seeing in this slide is the First Nations active community assessment, and it is split into three different parts or segments. And so the community environment and policies and program segments are acting like an audit tool that would be completed at a community-wide level, for example, by a community assessment. And then the other part, the community perceptions, is a self-administered tool. And that's something that could be given to youth who are involved in physical activity programming to allow them to comment on those elements that they perceive to be influencing their physical activity. And so, of note, in the community environment section, that's where you'll see discussions around infrastructure and the natural environment, as well as space for people to talk about the seasonality of physical activity. So especially up north in Canada, physical activity often changes season to season and may look drastically different in the summer than it does in the winter. And there's also space in there to talk about other things that the community felt were important to talk about in terms of influencing the physical activity, things like flooding or the presence of animals. So, was there bears that prevented them from accessing different resources at different times, as well as the presence of insects, so things like mosquitoes that may influence, impact, or inhibit physical activity at different times. In terms of the community policies and programs, a number of the things that were mentioned were both at the chief and council level as well as the school and organization level. And one thing that was particularly important for youth was to talk about age and skill appropriate activities. And so one thing that a number of youth mentioned was that just because of the number of youth that were living in the community, that oftentimes programs were put together, but they weren't necessarily put together for specific age groups or for specific skill levels. So some people would leave that program or they weren't engaged by it. And so that was one of the things that was added to that tool. And then in the community perceptions, in the social environment, things like bullying, the presence of dogs in the community, role models, parents, volunteers, as well as connections to ancestors were things that were added to that section. And so what makes this tool effective and why would this tool be something that's useful when working with Indigenous communities? And one of the things is that because we are adapting a validated and reliable tool, the RALA tool, that we can use that to support our tool as well as doing our own validity and reliability tests. But one of the things that perhaps is unique in terms of what's available for First Nations physical activity environment tools is that because the tool is meant to be interactive and engaging, is that it supports the building of those relationships and also making sure that people are accountable to their decisions. And so many of the communities talked about more broadly being involved in research projects and projects with government agencies where people would come in and they would take data and then they would leave with that data, but they wouldn't see those people again. And so one great thing about the tool is that it provides local data that can be used and help create and build on that relationship. And the other thing too that the tool does is that a lot of people mentioned the practicality of it and that it promoted reciprocity. And so it can be a tool that can be used to recognize different types of programming that could be beneficial to the community and therefore can be something that leads to those benefits for the community that's using the tool as well as people who those results are shared with. And so some potential advantages is that the tool has is that it does have flexibility to meet local needs and supports local decision making. And so far, one of the ways the tool has been used is to help people apply for funding. And so the tool outlines a number of different features in, for example, infrastructure, that people can use to check off that can then use to apply for funding that's available through the government or through their regional government. And the other thing, too, is that it supports sharing. One of the great things that we saw come out through this tool is that in the 3 communities that were involved, they weren't necessarily in communication with each other before we started this project. And so sharing this tool and sharing those results with the communities meant that those communities could then be familiar with the successful physical activity programs that may be culturally relevant and sharing that with fellow nations that are involved in the work. And in terms of projects that use the tool, one great thing is that when we take a broader view is that it provides a really good example of how we can potentially integrate both Indigenous and Western knowledge. And so oftentimes this is called two-eyed seeing. And so where you take the strengths of Western ways of knowing and you take the strengths of Indigenous ways of knowing and you find projects that use both of those strengths to provide a more comprehensive or thorough answer to something. And so the First Nations Active Community Assessment, drawing from both community expertise and the RAWA tool, is an example of how that might be able to be done. And the other thing, too, is that it promotes partnership building. And because we're talking a lot now in Canada about reconciliation and with the Truth and Reconciliation Commission, that this presents an opportunity where we're not necessarily doing helicopter work anymore, where we just go into a community, take from a community and don't return anything back to the community, but potentially represents an area where there can be sharing. And so the work that you've seen presented in my presentation has been published, and I just shared the link in the chat box for anyone who's interested in reading about that. And so with that, I'll finish off, but I just wanted to acknowledge that the communities that we worked with on this project, as well as funding from the Canadian Institutes of Health Research and Health Canada that supported our work.
Thank you very much, Colin, and thank you very much, Renee. I am mindful of the time. It is after 11:30, and I want to make sure we end it approximately on time. So if you do have questions for any of our speakers today, please feel free to send an email to my colleague Celeste. Her email is celeste@bchealthycommunities.ca, and she will type that into the chat box momentarily. If you do have questions, we will forward them to the speakers, and then when we send out the link to the recording as well as the link to the tool guide, we will include their responses. Other than that, I want to say thank you again to all of our speakers, and thank you to Vancouver Coastal Health for helping to support this webinar. If you have any questions about the PlanH program or about Vancouver Coastal Health, please feel free to visit www.planh.ca or send either myself or Celeste an email. We're happy to connect with you in any way possible. Thanks again for joining us, and we will see you again next time.